Hello, and welcome to the benefits presentation for Easterseals, Washington. We are pleased that you are joining us today, and we'll do our best to give you a good summary of the benefit program. Today, we will review eligibility and enrollment, provide an overview of the Easterseals benefits, show you how to enroll, and where to go when you have questions. This year, we will be replacing the Kaiser HMO plan with the Kaiser Virtual Care HMO plan. Unfortunately, this plan is only available in certain counties. Our Yakima employees will not have access to this plan, so those employees will continue to be offered the current HMO plan. All other offices will be offered the new virtual care plan, and we will explain that in the next few minutes. Our PPO plan will have some changes as well. This is the plan that allows you to see any doctor. The name of the new plan is Summit 3000. Medical costs are increasing every year, and Easterseals is doing our best to provide an affordable benefits program. We are very pleased with the new options that will be offered in 2021. We made the decision to offer affordable coverage without compromising quality. Everyone will have two options to choose from. There is a new plan available, but it is not available in Yakima. Therefore, the Yakima employees may retain the current Kaiser HMO plan. The current PPO plan is being replaced with a very similar plan called Summit 3000, and all employees will have the option to choose this plan. Employees are eligible to enroll in the benefits programs if they are working at least 20 hours per week. You may also choose to enroll your legal spouse, registered domestic partner, or any children under the age of 26, or over age 26 if disabled and have had continuous coverage prior to turning 26. All employees are eligible on the first day of the month following 60 days of employment. Every year we have an annual open enrollment which allows you to make changes, such as enrolling yourself or family members that weren't previously enrolled. This open enrollment period is at the end of the year, and coverage is effective on January 1st. Once you have made an election to enroll in or decline a plan, you may not change your election until the next open enrollment period unless you have a qualifying event. Examples of qualifying events are marriage, divorce, birth of a child, or loss of other coverage. If you have a qualifying event, notify Human Resources within 31 days or 60 days in the event of a birth or adoption. At that time, you will have the option to change your election. Now, let's review your medical plan. Here is an introduction to the new VP HMO plan. As mentioned earlier, this plan is not available in Yakima because there are no Kaiser facilities there. VP stands for Virtual Plus. With this plan, you can access a nurse 24/7. You can have virtual visits with Kaiser doctors and clinicians and get referrals to see a doctor in person. You also have access to Kaiser pharmacies. With the new VP plan, most care will start with a virtual visit, even for a specialist. There is no charge for a virtual visit, nor is there a charge for in-person preventive care or your first visit with a primary care doctor if you have a referral. This particular plan requires that you seek care with a Kaiser doctor. You will get your medications through Kaiser, and most medications will be provided through the mail order service. If you do have urgent or emergent care, this plan will cover those services. If you go to a Kaiser walk-in clinic, you must have a referral in order to have less out-of-pocket expenses. This is a glance at the benefits of the new VP HMO plan. Again, this is for employees in certain counties and doesn't include Yakima. Even if you aren't eligible for this plan, the following information is important to understand and will apply to all the plans we offer. When you are reviewing medical plan options, it is important to focus on four main components of your medical plan: the deductible, the coinsurance, out-of-pocket maximum, and the copay. The deductible is the amount that you pay before the insurance company pays anything. If a service is subject to the deductible, that means you pay the full amount of the service until your annual deductible is met. The deductible runs on a calendar year, January through December. You don't have to meet your deductible for office visits, prescriptions, or urgent care, or if you are treated and released from the emergency room. The coinsurance is the percentage that you pay once your deductible is met. This means that once you've met your deductible, the insurance company shares some of the charges with you. The out-of-pocket maximum is the maximum amount that you can pay in 1 year before the insurance company takes over and pays for everything. The out-of-pocket maximum includes your deductible, coinsurance, any copayments paid, and any prescription drug costs. The out-of-pocket maximum does not include any premiums that you pay out of your paycheck. The out-of-pocket maximum is typically the most important number to focus on because it is the maximum amount that you could pay in 1 year, even if you had millions of dollars of claims. The copayment is the amount that you pay when you seek a service. The copayment does not go toward the deductible, but it does go toward your out-of-pocket maximum. The copay on this plan is $30 if you are referred to an in-network primary care physician. If you are referred to a specialist, those visits are $60. As mentioned previously, as long as you have had a virtual visit first and received a referral, you don't have to meet your deductible prior to an office visit. However, if you see a doctor in person without a referral, you are then responsible for the deductible first, and then will also pay coinsurance once that deductible is met. This plan has a $2,500 deductible for a single person and no more than 2 deductibles for a family during a calendar year. Your coinsurance is 30%. Kaiser will pay 70% of your claims after your deductible is met. Your out-of-pocket maximum is $5,000 for a single employee for the calendar year. This means that in a worst-case scenario, this is the most you would pay, assuming you are using in-network providers. Families are not responsible for more than 2 out-of-pocket maximums per year. You also have a $20 copayment for Tier 1 prescription drugs. These are usually generics. If you choose a Tier 2 drug, you will pay $40 per prescription. Tier 4 drugs are covered with a $150 copayment. You can also purchase medication through the mail and will receive a 90-day supply at a substantial decrease in cost. Please keep in mind that you do have to receive maintenance medications through the mail on the VP-HMO and Summit 3000 plans. Your prescription costs and your copayments all count toward your out-of-pocket maximum, so you won't spend more than $5,000 a year even if you take an expensive drug or have surgery as long as you are using in-network Kaiser providers. As mentioned previously, you do not have coverage for care outside of the Kaiser network on this plan. Sometimes Kaiser doctors may refer you to specialists in the area, and if they do, you would be covered for that specialist. Please refer to your summary of benefits for more detailed information. Please remember that if you are on the VP-HMO or the Summit 3000 plan, you must purchase all maintenance medications through the mail. These are medications that you take on a regular basis, usually daily. They will mail the medications to your home and delivery is usually within 1 to 2 days. Be sure to order your refills early so you don't run out. You can order your medications very easily through the mobile app, by phone, or by mail. The link below can be found on the Kaiser website about mail order and how to get started. This plan option is the same HMO plan that many of you have been familiar with in the past. This is for Yakima employees only, as the VP-HMO plan is not available in Yakima. This plan has not changed from the plan last year and offers a $30 copayment for office visits. The deductible is $2,500 and the out-of-pocket maximum is $5,000. All your preventive care services are covered in full with no copayment. You must see in-network providers on this plan, as there are no benefits for accessing a doctor who is not in the network. Prescription drugs are covered with a $25 copayment for a Tier 1 medication and $50 for Tier 2 medications. You can save money by purchasing a 90-day supply through the mail from Kaiser. This new Kaiser option allows you to see doctors either within the Kaiser network or through any first choice health provider. First choice providers are covered with in-network benefits, but copayments and coinsurance are higher than seeing a Kaiser provider. This plan has a $3,000 deductible for a single person and no more than 2 deductibles for a family during the calendar year for in-network providers. Your coinsurance is 20%. Kaiser will pay 80% of your charges until your out-of-pocket maximum is met, as long as you see a Kaiser provider. Your coinsurance is 40% if you see a first choice provider. Your out-of-pocket maximum is $6,000 for a single employee for the calendar year. This means that in a worst-case scenario, this is the most you would pay, assuming you are using in-network providers. Families are not responsible for more than 2 out-of-pocket maximums per year. The copay is the amount that you pay when you seek a service. The copay does not go toward the deductible, but it does go toward the out-of-pocket maximum. The copay on this plan is $20 for primary care doctor visits and $40 for specialist visits within Kaiser. If you see a first choice provider, the copays are $40 for primary care and $80 for specialists. Your prescription drug copay will vary between $15 and $150 for a 30-day supply, depending on the medication that is needed. You will also be required to purchase maintenance medications by mail on this plan, and you will save money by doing so. Your prescription costs and your copayments all count toward your out-of-pocket maximum, so you won't spend more than $6,000 for the year, even if you have an expensive drug or have surgery, as long as you are using in-network providers. You can also see a provider out of network. Benefits are reduced to 50% coverage after a deductible of $9,000 is met, and could be subject to balanced billing amounts that are considered higher than reasonable and customary levels. In other words, you could be charged 50% of the bill, plus anything that the insurance company has found to be above usual, reasonable, and customary charges. Please refer to your summary of benefits for more detailed information. There is a 24-hour consulting nurse line available for those after-hour, non-urgent calls when your doctor is not available. This line is available even during weekend and holidays. There is no charge to call the nurse line. You can download Kaiser's mobile app, where you can have access to a wide variety of tools, like emailing your doctor or scheduling an appointment, or even getting your lab results and managing your prescriptions. You can look up wait times at your local Kaiser facility as well. If you don't want to download the app, you can also access this information on the Kaiser website at kp.org/WA. Now, let's review your dental benefits. You may also choose to enroll yourself, your spouse, or any qualifying dependents in the dental plan through Delta Dental. Services for your dental plan are generally broken down into 3 categories: preventive, basic, and major. Preventive services include cleanings and are covered at 100% if you see a preferred dentist. On our plan, you can see any dentist you choose. However, as you see on the screen, benefits are reduced if you use a non-PPO dentist. Basic services include things like fillings and root canals and are covered at 80% if you see a preferred dentist. Benefits are reduced to 70% for non-PPO dentists. These services are also subject to a $50 deductible per covered individual, with a maximum of 3 deductibles per family. Major services include crowns, implants, and dentures. These services are covered at 50% and are also subject to your $50 annual deductible. The annual benefit maximum for this plan is $1,500 per covered individual per calendar year. Using an in-network dentist will allow you to take advantage of provider discounts. You will likely pay a little less for services, stretching your benefit dollar out even a little further. You can see any dentist you would like, but out-of-network benefits are also subject to balanced billing as discussed on the medical side. This means that any charges above reasonable and customary are your responsibility. This plan renews on January 1st each year. This means that deductibles and plan maximums will reset on January 1st. Now, let's review your vision coverage. Our vision plan provider is Vision Service Plan, also known as VSP. You are covered for an eye exam every year for just a $10 copayment. You can obtain lenses each year and frames every 2 years. You will have a $25 copay for your hardware. Your frames are limited to an allowance of $130 every 2 years. In lieu of glasses, the allowance for contact lenses is $130 per year. Now let's review your flexible spending account. A flexible spending account, or FSA, allows you to set aside up to $2,750 per year on a pre-tax basis that you can spend on deductible expenses, co-payments for office visits, prescriptions, dental or vision coverage, and other qualified expenses. You have access to your full annual election immediately and will have a debit card that you can use at the provider's office, pharmacy, or other approved facilities. This account helps you to save money on taxes and helps to budget items you may need throughout the year. Be sure to keep your receipts, as you may be required to submit them to substantiate your claims. If you don't submit your receipts timely, your debit card can be shut down until receipts are provided. You can also set aside up to $5,000 per year into an account to help pay for dependent care expenses. This can be used for children up to age 13 or a family member who is physically unable to care for themselves. You must have the money taken from your paycheck and in your account before you can submit a receipt for reimbursement. Please remember that these accounts can only be used for eligible tax dependents. Please take note of these important FSA rules. Unused funds will have 2.5-month extension to incur claims, which would be March 15th of 2021. And unused dependent care funds will not be returned to you or carried over to the following year. Let's talk about the transit benefit. You can set aside up to $270 per month in qualified transportation expenses on a pre-tax basis. You can use this money for parking or for transit passes or van pooling. You just authorize Easterseals to deduct the money from your paycheck and then either use your new debit card to pay for parking, or you can submit a receipt for reimbursement for parking or transit. Let's talk next about your benefit costs. Shown here is the per paycheck cost for your benefits. Easterseals pays the bulk of these costs for our employees, but there will be a deduction out of your paycheck to pay for part of it. If you have family members on the plan, we also pay 25% of the cost for your family members. And these are the costs for the dental plan. Easterseals has a benefits website, and if you haven't looked at it, we encourage you to do so. You can access this at work or with any home computer or phone. This website houses your benefits information, which includes links to provider directories, your benefit summaries, and any forms that you may need. Please follow the instructions on the screen to log in. You will also find this information in your benefit guide. Benefit Hub is a great tool that will give you access to over 200,000 vendors that will give you a discount just for using the Easterseals portal. Whether you're looking for a restaurant or tickets to movies, clothes, or even cars, you might start at this portal and see how much money you can save over retail prices. Target, NFL.com, and many other names you will recognize make discounted prices available for Easterseals employees. Spend some time on this site and save money. Here is the contact information for people who can help you. Our plan advocates at Hub are there to help you throughout the year. If you have any claim issues, questions about your benefits, or need any help whatsoever, please reach out to our team at Hub. They are there from 6:30 a.m. to 4:30 p.m. Pacific Time, Monday through Friday. Thanks for listening today. Please let us know how we can help.